Hello and welcome to the 61st Bi-Monthly Breastfeeding Coalition's webinar. I'm Kinkini Banerjee, the Senior Coalition Relations Manager at USBC, and I'm so glad to have you join us for this session today. This series is jointly hosted by CDC's Division of Nutrition, Physical Activity and Obesity and the USBC, and is held on the second Tuesdays of even-numbered months from 2 to 3 p.m. Eastern. And we alternate the sessions to bring you one session which brings you highlights from state coalitions and another from our national member partners. And this is an opportunity to share some happenings around the nation and also to network and collaborate on issues of national significance. These webinars are free and access is open to anyone interested in breastfeeding-related subjects. The topic and speaker details are posted about 2 weeks before each session, and these are on our webinar page on our website. And they're also, if you're a member of our Coalition Learning Connection, you could also get the notification from our Learning Connection page. So be sure to, I'm getting an echo. I'm going to, I'm not sure who that was, but I'm going to, is the sound better? I hope it is. Okay. So these sessions are also posted on our Coalition Learning Connection. So we've streamlined the access, and now the webinars have been set up as a series, and so you just need to register once for the series, and then you'll receive auto reminders for each session. And we know that this is middle of your workday and you might not be able to attend every session live, so we record every session, so you could go back to our archives and access any of the webinar sessions as well as the handouts and the slides for the session. So to get to the webinar page and to access the handouts for today's session, you can see them. They've been posted here. So you just click on the handouts and download them. But you also go for past sessions, go to our website, www.usbreastfeeding.org/coalitions-webinar, and here's how you do it. So you go to our website and you see the tabs across the top. Just click on coalitions and it'll take you to the CDC-USBC bi-monthly webinars. Click on that and it'll open up the page with today's topic as well as our past topics. And we have a lot of attendees for today's session, so we are all in listen-only mode, but we do encourage you to participate as much as you can and send us questions. Your questions can be submitted at any time, so please type your questions in the question box on your webinar control panel. And here's how you do it. On the right of your screen, you should see a control panel. If you don't see it, it might be minimized. So just click on that orange tab with that white arrow and it'll open up. Scroll down and just under the audio section is a blue tab called questions. Click on it and it'll open up a text box for you to enter your question. If during this session you have any technical problems or audio problems, send an email to coalitions@breastfeeding.org and our staff should be able to help you. Today, we are going to have a special breakout session after this session. Starting from today, for every 2 to 2, we will be going back to continuing the conversation on, in-group discussions and breakout sessions for our coalitions. So this is a separate event, and whether you have an existing state workplace law or a state bill pending in current or immediate past legislative session or no existing state law bill in progress, you can still participate in this hour-long session after the session ends and share your perspectives. If your state has a workplace law, is the implementation working well? What lessons are you learning? So we know that Lucy our presenter, has a lot to share today, and we will take a full hour to discuss Arkansas and their accomplishments, but we ask you to register separately if you want to discuss more on state workplace laws, accommodations, and programs. So for this, you need a separate registration to join. And if you look at your chat box, Danae should be posting the link for how to join that session. Well, and that brings me to today's session, Third Time's the Charm, an analysis of 3 worksite support programs in Arkansas. And this is really a great session to learn about how you can, for coalitions that are writing grants, that are working on deliverables on a tight timeline, how do you learn from the mistakes you've made, the strengths that you've done, and in the process. So our speaker today has really is going to present 3 different grants work that they did and how they learned from each one of those. So these were all the Arkansas Breastfeeding Coalition received 3 different grants to promote and assist with worksite support for breastfeeding in Arkansas. And you will hear how our speaker compare and contrast the aspects of each grant and the accompanying project. So at the end of this session, we hope you'll be able to understand the different models that the coalition used and really understand why innovative partnerships and collaboration are key to making a project successful. Our presenter today is Lucy Towbin, and I'm delighted to introduce her. Lucy has worked in public health and maternal and child health programs for over 30 years and has been an IBCLC for 20 years. She's chair of the Arkansas Breastfeeding Coalition and the primary grant writer and coordinator for the coalition. In her day job, she is a regional lactation specialist for the Arkansas Department of Health. For those of us who've known Lucy for a long time, she serves on various committees and coalitions, both at the department and to develop and implement projects to support breastfeeding. She has such a wide and rich experience base, and she brings her degrees in studio art and social work to really work on cultural issues and to bring, in her first job at the Department of Health, she coordinated the state's refugee health program. Lucy has 3 grown children who all breastfed into their toddler years. She also has a Vietnamese exchange student son who's in college in the US and visits on vacations. Lucy has a special interest in cultural and socioeconomic factors that affect health, and she works closely with the Minority Health and Health Disparities Program at her state. So we are very honored to have Lucy present today. And with that, I'm going to turn it over to you, Lucy. Take it away.
Okay, there we go. Oops. Okay, thank you, Kinkini. That was a really nice introduction, and I'm very honored to be here. And I hope that some of what I'm going to share will be of use to other states and coalitions, and that you can learn from some of our trials and tribulations with having several small grants, and I think improving with each one. I want to tell a little bit about Arkansas first, in that we are a small rural state. We have very low breastfeeding rates. The MPINK score for Arkansas has always been one of the very lowest. The most recent MPINK that came out were 52 out of 53. So we have a lot of improvement that we can still make. Our Breastfeeding Coalition formed in 2007. Originally, it was a small group of women, mostly Lactation League leaders and a few health department lactation consultants. And we started out working to get laws passed by the legislators. We had a really wonderful attorney volunteering through Lactation League who did the lobbying on these laws. So in 2007, we got a breastfeeding law enacted that excluded breastfeeding in public from the public indecency law. And then in 2009, we got a law passed to provide worksite support for women for pumping. And when I went to the USBC conference after that, I was so excited to learn that Arkansas was actually one of the first states to have both of these laws passed, because and we had other states asking us to, tell them how we did it, and we're usually either the bottom or near the bottom on almost everything. So it was exciting to not be in that position, at least with getting these laws passed. But then we realized after we got the laws through that having laws wasn't enough, and we needed to start getting more projects going and be able to get grants. And so in 2009, we did all the paperwork and became a 501c3. Arkansas Breastfeeding Coalition is the only coalition in the state. I know in many states there's the state coalition and local coalitions. We've tried to get that happening, but it isn't yet here. The coalition sponsors annual symposiums for healthcare professionals. That's the project that we've done several years in a row now.
Lucy, I can't hear you. I seem to have lost the voice.
Can you hear me? It's not muted. Can you hear me?
I can hear you, Lucy. Yes.
Okay. It's okay. All right, great. So we have an annual symposium, and we've had some very well-known speakers like Dr. Hale, Dr. Miriam Labach, Dr. Kendall Tackett, and this is for healthcare professionals around the state. And we have good attendance of that. Between 90 and 120 people have come to our symposiums. We have had a few other small grants. All of the grants we've had have been small ones, but you can still do a fair amount with a small grant. We've had a grant last year and the year before from NACHO to have a breastfeeding peer counselor down in one of the very rural, small, very poor counties in the Delta part of the state. We had a grant from the Arkansas Black Hall of Fame for a birthing project where we worked with sisters they call them sister friends, supporting pregnant women through the baby's first year, and we had breastfeeding support and a class as part of that project. And we had a grant from the health department to do focus groups around the state on breastfeeding issues. So that's some of the other things we've done. So let me go ahead and start discussing the grants that relate to Worksite. Now, this may be a little confusing, but we are in the midst of a third separate grant, which is the second one from AMCHIP. But because it's still in progress, what I'm doing here is I've broken the AMCHIP grant into two parts, and you'll see why. But so I'm going to be talking about this Office of Women's Health grant, and then the AMCHIP grant part 1 and part 2. And at the end, I'll say a little bit about our current grant. So in 2013, we had this grant from the Office of Women's Health. It was a small grant of $3,950. We had the goal of it was to work with employers in the central Arkansas area that employ low-income women. So our thinking was that we wanted to have work with employers where there was the least chance that the women already had a good place to pump their milk. Places that most people would not have a private office, and yet we wanted to choose places that would probably employ a lot of women. So we chose factories, large stores, hotels, that sort of thing. We mostly concentrated first on factories and then branched out a little bit. So we worked together on this project with some interns from Arkansas Department of Health's Worksite Wellness program, and we did get advice from the Worksite Wellness chief also on how to implement the project. That was useful to us. She had several interns working with her at the time, and they did the initial part of the grant as part of their internship. So we didn't have to pay for that part. The interns made and sent letters which had both the Arkansas Department of Health and the Arkansas Breastfeeding Coalition logos on it. We thought if it had the health department's logo, maybe employers would pay more attention to it than just coming from some coalition they'd never heard of. So they sent those letters out, and they made initial phone calls to the businesses for us. And then from that list, from what they had sent out, and with notes from them about what had transpired in their phone calls, we contracted with peer counselors who followed up and visited the sites to offer recommendations on accommodations for women on how to pump. So it's not progressing to the next slide.
Can you click on it and then, or do page down? Use the arrow on your keyboard.
Oh, down. Okay, I was trying to. Okay, got it. Okay, so for this Office of Women's Health grant, the person we contracted with first was a former breastfeeding peer counselor for the WIC program, and she was at that time no longer working as a peer counselor, but she was working on her master's degree in technical writing, and she has a very strong interest still in breastfeeding, and in fact was writing her master's thesis on classroom curriculum for breastfeeding classes. So she did the main part of the work for this project. She did about 2/3 of the work, but then she had some time issues with other things she was having to do and wasn't able to do all of it. So we hired 3 peer counselors who were working for WIC, but had some time on their off hours when they weren't at WIC to complete the grant activities. So for the materials for the project, we ordered copies of the business case for breastfeeding toolkit, and this was back when there were actual physical copies available. They were, if for those who haven't seen it, it was really nice. It came in a box with several really nice glossy folders. It had a DVD in it with a PowerPoint on it. It had sample brochures, which you could order more of. And we were able to get enough of these to use for our project. They were kind of phasing them out at that point, but they had enough left that when we told them about what we were doing, we were able to get enough to use for the project. We also ordered from Lactation League their brochures on working and breastfeeding and on safe sleep, and Noodle Soup's laid back breastfeeding brochures. We felt like those were issues. Well, of course, the working and breastfeeding is an obvious one, but the other 2 issues were maybe things that less was known about by moms, and those brochures were to be, given to the employers to put in any lactation area. So altogether, we contacted 94 businesses by letter or phone call. Of those 94, our peer counselors visited 35 businesses. At the point we hired the 3 additional people, we started, because we weren't getting very good responses from the list we had initially mailed out to, some of them started offering to contact businesses where they personally knew somebody in management that they knew and thought that they would be able to get in better and be more effective. So that was one slight change we added just because it seemed like a good idea. And so we gave each of those 35 businesses one of the business case for breastfeeding kits. But we felt it was important that this was done in person by the peer counselor. We didn't want to just hand it to someone and have them stick it on a shelf and never look at it. So the peer counselor would give it hopefully to the HR managers if they could, and they would open it up and go over, you know, what was included in the kit and talk about some of the issues with the HR directors. They toured the facilities and they made recommendations about options for where women might have a private place to pump. So being this as small grant as it was, we didn't have a lot of time or funds to do a lot with evaluation. We did do some follow-up calls with 13 of the businesses, and some of them showed some progress, but as far as developing a policy, they said that they were working on it, but they had not made much in the way of concrete steps, except for one. We had one business that was so enthusiastic, it still, even though it was just one, we felt like it was all worth it. The CEO of a peanut butter company factory, she had worked in another state for the same company and had set up a lactation room there, so she didn't need convincing, but I think she was just waiting, or you know, it was the initiative she needed to get something going at her company here, and she even asked for more than what we had just offered, and we got her some posters and some other things. But we do hope that although there was only one company that made changes during the grant period, we did visit with and talk in person to 34 other companies, so we hope that we have planted some seeds with them, because what was surprising to us is that not only were they unaware of the federal and state laws about supporting women at work sites, they were really clueless about, you know, why would they need to have a place to pump. Most of the HR directors were men, and we heard a lot of them say, oh, sure, of course, we'd be happy to try to help a woman, but we wouldn't know if somebody's breastfeeding or not, so we assumed that she would come to us and talk about it if she was. And you know, the reality is a woman who's working in a factory, she may not even know who the HR director is or feel comfortable to go to talk to somebody like that. And so we tried to help them see why it was their role to at least make it known that they would be supportive if someone needed support at their company. So some of the things we learned about from this first grant from the Office of Women's Health are that implementing a project like this is not necessarily the same skill set that someone would have to be a breastfeeding peer counselor, and that it's not, you know, to implement a worksite project, you don't have to know everything about the details of breastfeeding and how to, you know, help a mom with various problems. That may seem like an obvious thing to say, and yet in our thinking, because we're all lactation consultants and peer counselors at the coalition, that was sort of our automatic go-to of who we would hire, and that's not necessarily the right people to do a project like this. Cold calling is time-consuming and not very productive. I'm sure that's well known in business, but we're not business people, so we tried it. Sending letters doesn't take as much time, but it gets even less results. And choosing the most at-need population doesn't always work best. Sometimes you need some successes, and we felt like with this project, even though what we had proposed sounded like the best noble thing to do, to choose, you know, factories and where all low-income women work, there's some advantage to maybe choosing some places that you're more likely to have success with too, because hopefully word will grow from there. And then when you work with your companies like factories where it's a more difficult place to set up something like a lactation room, they may have some role models or have heard from other business managers about it. And that sometimes your first task is just making people aware that there's a need for what you're providing, like our HR managers who, were trying to be nice and helpful, but really didn't have any idea that there was any reason why they might not need to even think about this. So then the second project was from a grant from AMCHIP in 2015. And I'm going to talk about part one, the first phase of it. It was supposed to all be one grant, but as you'll see, we kind of had two different parts and two different outcomes and issues. So this is the first 2 months of a 6-month grant. So the grant was for $15,000. The first month we used $39.50 of that. Part of the funds we used to join the Chamber of Commerce. That was one idea we came up with after our Office of Women's Health grant. Like, oh, well, maybe if we had joined the Chamber of Commerce, because that's where businesses are all members, and that would be a good connection and a way to get in with businesses. So that was one of our goals for this grant. And also, when you join the Little Rock Regional Chamber of Commerce, you get one free mailing list on mailing labels as part of your membership. And then if you want to, of all the members, and if you want another one, you have to pay for it. So our plan with this one was to work with businesses in Central Arkansas and through the list we got from the Chamber of Commerce and making individual visits, again, similar to the first grant. So for this one, we contracted with a WIC peer counselor who was also an IBCLC, and she had been involved with the coalition in several projects and had been attending our executive committee meetings. But unfortunately, we had some issues with her and with getting the work done, and so the executive committee met again had a special meeting just about this and we decided to implement more stringent documentation for her to do and closer supervision. And then we met with her and went over all that, and it seemed to be agreeable to her. And then within a week after that meeting, she quit. So one of the things that we didn't really have, and again, this may be obvious to lots of people, but we didn't really realize that if you contract with someone, they are supposed to be able to work totally independently, have their own computer, their own car, their own every equipment. You're not supposed to have to supply that or supervise them on a close basis. You're contracting for the project to be done, and we've learned since then that that's the expectation we should have. Also, I think we really didn't do enough discussion of what kinds of job skills were needed in advance when we were planning the project and who we might be able to get it. And I think part of our difficulties we've had with getting people to contract is that these grants have all been very small, so it's all part-time work. And that does make it harder to find people than if you have a grant where you can hire somebody full-time. And again, as with the other one, a peer counselor or an IBCLC may not be the best person to carry out a project like this. And this time we realized we really should always have a backup plan. So we had kind of a transition where the executive committee was in a bit of a panic because it was only a 6-month grant and we had already used up 2 months, including 2 months worth of funds. And we thought we were going to have to divide it up amongst ourselves and do the work ourselves, which all of us have other full-time jobs and hadn't been prepared to do that, but we were kind of scrambling to figure out what to do. And luckily, I was in a meeting and happened to find out that the person who I referred to with the Office of Women's Health grant, who was our Arkansas Department of Health's Worksite Wellness Chief, Bureau Chief, that she had just resigned from the health department and was going to work full-time for another coalition. When I say going to work, she really wasn't funded at that point to go to. She was doing it as a volunteer and looking for funding for the work she was doing for this coalition called ARCOP. So the timing was perfect to, and I talked to her about this project, and she was very excited about it too. So we contracted with her to do the remaining 4 months of this AMCHIP grant. And really, I feel that she was the best person in the state to have done it as far as her work experience goes. So I'm going to tell you a little bit about this coalition called ARCOP because I feel that it's one of the key reasons why our grant ended up so successful, because she had already been very involved in ARCOP. I've also worked with ARCOP on several committees. Excuse me. So ARCOP stands for Arkansas Coalition for Obesity Prevention, and it works to bring about healthier environments in Arkansas. Arkansas has one of the highest obesity rates in the country, but ARCOP has had some really good success with all kinds of projects and working with various communities all over the state. They do things like have community gardens. They have walkability studies they'll do with a community to encourage better walking areas and bike paths. There's been some early childhood committees and projects going on, so they have quite a few different aspects to what they're doing to reduce the obesity rates in Arkansas. They have over 2,000 members and more than 100 partner institutions in their coalition. So a big part of what they do at ARCOP is called growing healthy communities. And these are communities around the state that are working with ARCOP to become healthier and trying to get the little bar out of the way, to become healthier economically, policy-wise, nutritionally, and physically. There's over 60 different communities in Arkansas currently involved with ARCOP as growing healthy communities, and they're at different levels depending on how long they've been involved and what steps they've taken in their communities. So ARCOP already had all these connections with various communities around the state, which was ideal for us because we had tried, various methods of connecting with businesses, and our success had been pretty limited. And here they had 60 communities who already have the goal of becoming healthier in many different ways. So it was a perfect partnership in working toward the project of worksite support. So ARCOP provides technical support and expertise to these communities. And if you are a designated growing healthy communities and ARCOP gets any grant funding, you're qualified to apply for the grant funding that they get. Okay. So for this third version of Worksite project, because the person we contracted with already had knowledge about worksite issues. She suggested that we use this health scorecard, which you can get from CDC's website. And this health scorecard is specifically for use with businesses to identify needs and gaps at the worksite in having a healthier having healthier employees. So this is a picture of the section of the health scorecard on lactation support. Now I've got it written out here because I think you can read it a little better. So these are the questions that are on the health scorecard that specifically apply to lactation support and the number of points for each one. So this is what we used as both a pre-test and a post-test for this project, and to show what changes have been made by the businesses we worked with. So the first one is, do you have a written policy on breastfeeding for employees? Second one is, do you provide a private space other than a restroom that may be used by an employee to express breast milk? Third is, do you provide access to a breast pump at the work site? Then the fourth is, do you provide flexible, paid or unpaid break time to allow mothers to pump breast milk? And then, do you provide free or subsidized breastfeeding support groups or educational classes? And do you offer paid maternity leave separate from any accrued sick leave, annual leave, or vacation leave? So this is what we did in this third version of our Worksite project with each of the businesses. Our contracted person met with the businesses that she got interest from the Growing Healthy Communities, and she went. I took now that the business case for breastfeeding is all online, you can download the PowerPoint and you can change it. So I downloaded the PowerPoint from the business case for breastfeeding and just updated a few statistics, and then I added statistics and information about Arkansas. So if you haven't seen this PowerPoint, what's included in it is what the health impact of breastfeeding is, how is breastfeeding or having breastfeeding employees good for business. Then I included Arkansas statistics on breastfeeding, and then a lot of the slides are on what you can do as an employer to be included to provide worksite support for breastfeeding. So this is a really good thing, I think, to use because it's already made and you can change it if you want to add things for your state. So we had that PowerPoint, and our contracted person went around to the businesses, showed them the PowerPoint. We printed out some of the brochures also from Business Case for Breastfeeding for Employees, gave those out. We took the copies of the lactation accommodation laws, both the Arkansas law and the federal law, and then the breastfeeding business case for breastfeeding brochures. So she did the pre-test of that health scorecard, and she went over it with the employer and discussed it. And then if they were willing to make an accommodation and have a space for women to pump, we gave them a list of items that they could purchase if they made accommodations. This was one of the differences in the AMSHIP grant and the Office of Women's Health grant too, because we had allocated funds up to $500 per business to help them with accommodations. And I believe that this was part of why this was more successful too, because people are always going to be more willing to make some change if there's something in it for them. And of course, hopefully we've helped them understand what's in it for them as a business as far as their women being healthier and the babies being sick less often and all of those things too, but just having one concrete thing for them to say, oh, we get to purchase something if we make these changes, we felt was helpful too. So when she made the site visit and told them about, we gave them a list. We'd made a list up in advance about what types of things they could purchase that would be appropriate for a pumping room. So some of the things that were included were signage for putting on the door locks, curtains, or partitions if they were unable to have a designated room and they just needed to partition a room, a mini fridge, a glider, a rocking chair, side table, or brochure holder. And then we did the health scorecard again as a post-test for comparison. So this shows you our results. Okay. So this over on the left, you see the cities where we had the businesses that participated in the project. All of these, well, Arkansas is pretty much small town and rural, other than Little Rock and one or two other mid-sized cities. So some of these cities were very small, some were mid-sized. So as you can see in the second column, there were two businesses that made accommodations and didn't ask for any funds. So that was great that they didn't feel that that was a necessary part of it, and they decided to make changes anyhow. So then received education. So she talked to and did the PowerPoint presentation to that number of businesses in each of those cities with a total of 32. And then the accommodations were actually made and we gave funds for the items to be purchased. And they, even of the ones that requested some funds, they didn't all ask for the full amount. So there were 17 businesses that did make a change out of the 32. So that's a pretty good percentage. So from the follow-up questions from the health scorecard, the first question is about policy. We did not have any changes made in policy, but you have to remember this was only a 4-month period, so we didn't feel badly about that, but it takes time to get policy written and implemented, and so there were no new policies written during the grant. As far as having a private space for women to pump, we had a 65% increase from 35% to 100% with the project businesses. We only had 12% provide an actual pump, but I'm not surprised about that. The big increase, I guess our biggest increase, was in the employers agreeing to let the women have flexible time for pumping, which is, of course, very important. Education, that's about having an actual support group or educational class for employees at the business. Not a big increase in that, but that's a big thing. I'm not too surprised on that one either. Okay, maternity leave, we actually already had a pretty high number of them, so there were no changes there. So lessons learned from this most successful grant is that sometimes you have to start with the low-hanging fruit. As it was, sounded great to us and felt good with our first one to say we were just going to, use these low-income employers, factories, and that sort of thing, but having connections like we did in this grant and businesses and communities that were already dedicated to making healthy changes made a big difference, and we hope that they will be leaders in encouraging other businesses to do the same. Having the right contractee is really key. We were very lucky in the timing and being able to get the person that did this final phase of this grant, and partnering with the organization she's already involved in, RCOP, was great. We have similar goals. Breastfeeding has always, I've tried in other aspects of RCOP to get breastfeeding projects going, and they've always seen it as an important thing, but this was the first time that they actually helped implement something related to breastfeeding, and RCOP now has worksite support for lactation as part of the projects they present to help their growing healthy communities on their own, not just our grant. So it has encouraged them to do more with breastfeeding too. And finally, having a group training, if possible, would save time, because our contracted person went around from employer to employer around the state, and that's not the most cost-efficient thing to do. So if you can have it as a group training, that's better. This is just a PS in that we are currently working on another AMCHIP grant, and the two things that are a couple of things we're doing differently are we're going to do the group training, and we're providing lunch for the employers to all come to a training in Arkansas next month in Little Rock. And we have set aside some funds to update the Arkansas Breastfeeding Coalition's website to recognize employers who've made accommodations, and we have some funds to publicize it. So we hope that that will be an encouragement, kind of a reward for them as being family friendly and supporting breastfeeding, and perhaps encourage other businesses to do the same thing. And that is my presentation, and I'd be glad to take questions.
Great. Thanks so much, Lucy, for such a candid and honest assessment of your worksite programs, and your insights bring, some very important points to make, and that is that breastfeeding, when you embed it in larger initiatives at the state level or county level, you see that you can increase the scale and scope of your work, that it's so important to have like multi-sectoral representation in your coalition. So we find that as our coalitions are doing more work with breastfeeding public health partners like NACHO and ASTO and AMCHIP, and getting more funded grants, that they are looking to get, techies or folks with marketing skills, social media savvy, or project management. All of these are so critical for the work you do. So, and for those, if you also, I'm going to put the link for the Supporting Nursing Mothers at Work, the employer solutions. If you go to womenshealth.gov, you can see that. That has such great, again, resources for different kinds of employers at different. So we're going to open for questions. And Lucy, could you tell us a little bit more about how you were able to leverage the Chamber of Commerce connection? Did you also connect with SHRM, the Society for Human Resource Management in your state, to be able to do this?
We did not connect with SHRM, no, that has been mentioned. The Chamber of Commerce, I learned a lot because I've never been a business person, and I never even really knew what Chambers of Commerce did. So both the person we contracted with for this AMCHIP grant and I attended, after we joined, we attended Chamber of Commerce events. We had a table at the Chamber puts on a fair for nonprofits where people can come and get information about nonprofit organizations. We did have a table there with brochures and talk to people about our coalition in general. The events that we had hoped would be helpful in recruiting businesses were they have luncheons where they have a speaker, and then you're sitting at a table, of course, with other business people, and you network with them and talk about, your own business and what you're doing. And then at the very end, everybody in the room, and I guess there were probably 30-ish people in the room, the one I went to, and our contracted person went to one. You stand up and you tell about your business, or in our situation, coalition, and what you're doing. So we took brochures along, and we took business cards, and we talked about our project for Worksites at those luncheons. We did not get any. We had one person say they were interested, and then nothing really happened with that, and so we did not get a lot of interest like we were hoping we would from being members of the chamber. Of course, we did the big mail out with the mailing list that they gave us as part of our membership, and really didn't get much response from that either. So it might be useful, depending on other states, what's available as part of the membership, but we didn't find it to be nearly as helpful as joining forces with RCOP and the Growing Healthy Communities.
Thank you. Is there your pre-post test? Is that available? Is that linked to your website? I know you're going to develop that. Update your website. How might our is that something you could give us that we could post on our?
It's on one of the slides, but I can send it too. It's at CDC. On the CDC website, but it's kind of a lot.
Yeah, it's embedded in that, right? So you created that scorecard. If you can send it, we'll just post it as a part of our handouts, Lucy.
Okay.
Thank you.
Sure.
Okay, and then how many hours of approximate contract work was needed for a project of this scale? Would you be able to, just off the top of your head, be able to share that?
Oh, I'm not good at remembering that kind of thing.
No worries.
Okay.
we can send that. There are, I think, folks here who are considering other workplace projects as well, so wanting to know what the compensation rate were, what hours you needed for a project of this scale. We could.
And I'd be glad to send anyone that's interested. I'd be glad to send them a copy of the grant if they're interested. And part of working together with RCOP and the Growing Healthy Communities project is that the person, for example, sometimes we had mileage built in as part of the expenses of the grant, but sometimes she was traveling to a given community anyhow, or something she was doing for RCOP, so then she didn't have to bill us for mileage, for that trip, or vice versa. Sometimes she didn't have funding for it, and so we did pay her mileage, and then she did some other things for RCOP. So I think we worked together well in that way.
Right. All right. We do have some questions coming in, and I promise we will send those to Lucy and have those posted on our website. It's time to, thank you so much, Lucy, for this. It's time to move on to our CDC updates, and I'm going to invite Carol McGowan, our public health advisor from DNPAO, to provide CDC updates.
Thank you, Kinkini, and hi, everybody. This is Carol McGowan, and greetings from CDC in Atlanta. I have some very quick updates. Let me start with MPINC. This is probably news that you already know, but since we didn't announce it on the last 222 call, I'm going to say it again, that our individualized hospital benchmark reports were sent to birth centers and hospitals, the ones that participated in the 2015 data collection, And the MPINK state reports were sent to key public health leaders at the state level and have also been posted on our MPINK website. The state reports are also available in Spanish, and if you want a PDF of a Spanish translation PDF, you can request those for any one of the states for 2015 only, though. And that would be at mpinc, M-P-I-N-C, mpinc at cdc.gov. Now for some real quick baby-friendly update. I think this is going to be very, very interesting to you. We now have 19.6% of U.S. births at baby-friendly designated hospitals. 42 states have met or exceeded the Healthy People 2020 target for percentage of births at baby-friendly hospitals. And our target for 2020 was greater or equal to 8.1% of births at baby-friendly hospitals. 24 states have doubled it. So 24 states are at least at 16.2 of births in baby-friendly hospitals. And in 8 states, at least 1 of every 3 babies is born at a baby-friendly hospital, or greater than 33%. In 3 of those states, more than half of all births are at baby-friendly hospitals. So congratulations, we're all working hard and we're getting there. More closer to the work that CDC is doing, you all know about the Best Fed Beginnings project. I just wanted to give a quick update about that. Of the hospitals that were enrolled in the Best Fed Beginnings project, although that project ended in 2015, the hospitals have continued to work towards designation, and 75 of the 89 Best Fed Beginnings hospitals have now earned baby-friendly designation. And I think there's a really good lesson in there in that the work doesn't end when the funding and the project ends, but the hospitals that are committed to it could keep working on this. So on that note, the Empower project is in its last year of funding, and to date, 4 of the 93 hospitals enrolled in Empower have reached baby-friendly designation. So like I was saying, if BFB is any indication, then the remaining 89 hospitals that do not quite achieve designation by the end of this project will continue to work towards that. And then I wanted to give you just a really quick update on our project funding that goes to the National Association of County and City Health Officials, or NACCHO. I wanted to bring your attention to the fact that they are offering continuing education credits for a 5-part webinar series. And these credits include IBCLC, CERPs, and CMEs as well. So if you're interested, I think they've had 1 of their webinars already out of the 5-part series. If you're interested in participating in that, go to their website. And the best way to find it for me was just go to NACCHO Breastfeeding, and it'll pull it right up for you. And I think I'm going to stop with that because it looks like we're running out of time. Thank you, Kinkini.
Thank you, Carol, and just such exciting news. And when there's concerted funding and initiative and coordinated action, look at what can happen. So thank you for keeping those going. And just as Carol mentioned, the NACCHO, Arkansas also had a project with NACCHO, and you can read about that when you go to the NACCHO website. Do read the NACCHO stories as well about all the projects that have been happening with breastfeeding coalitions across the country. And now I'm going to invite USBC Executive Director Megan Renner to give us some updates from USBC. Megan, you're on.
Great, thank you, Kinkini. And I will be very quick because I know we're in our last moment here before moving over to our no longer regional but still breakout discussions, this time talking about different angles on the workplace support topic. So we hope you're going to join us over there. Very quickly, before we do that though, just wanted to update folks that, as you may have seen if you're on our email lists, Weekly Wednesday Wire and so on, we are actively mobilizing and planning for the new year in terms of action that we will need to take to continue all of the great work and to sustain and protect the policy gains from the last few years. So please do watch for a couple of things. One is that we are getting ready to announce a briefing that we'll do on the 20th at 2 p.m. Eastern Time. So if you haven't yet held that date on your calendar, please do plan to join us. So a briefing on the 20th about action for the new year at 2 o'clock Eastern Time. We also will be mobilizing to have an event in DC the week of the 9th. Actually, it is looking like it will actually be the 9th, but also we will be announcing that date in the next 24 to 48 hours. To make sure that you are fully up to date on all of these actions, I just want to call out that we hope you are on the Weekly Wednesday Wire or our direct action list. The link is up here on the screen. And also that you are connected to the Coalition's Learning Connection. So many of you might have perhaps joined this webinar series in the past, but maybe you haven't joined the Coalition's Learning Connection in the new website. That's the link at the very bottom of the page here, which has a special Coalition-only announcement list through which Kinkini and Danae send lots of great news, including and especially the webinar series that we host. So please do make sure you're connected to us. We're going to have lots of great news and updates for you in the next few weeks. And we're hoping again that you'll join us on this next hour. I'm going to flip over there and start getting ready to greet people over there. Thanks, Kinkini.
Great, thank you, Megan, and thanks for all you do. The work that we do is all about partnerships, coordination, and collaboration, and it's truly amazing what we can accomplish together to impact the landscape of breastfeeding support. So thanks for all that you do. We hope very much that the 222 webinars bring you ideas, and complete the webinar evaluation, please, and let us know how we are doing, and your suggestions are valued, and we do read your evals and read your suggestions and bring you topics that are most pertinent to you. So goodbye for now, and we hope you'll join us to continue the conversation for this next hour on Maestro. Thanks, everyone. Until next time.